Hello everyone. Happy New Year to all of you. I'm Dr. Atika Agrawal. I'm a cosmetic dermatologist. Hope everyone is enjoying winter, sitting in balcony, soaking in sun, having a hot cup of coffee or tea, whatever is your preference. But do you know all these can dehydrate and tan your skin and make it look dull and dry? So let's discuss what is skin. Skin is made up of number of layers. The upper skin layer is a dead layer which has urea, lactic acids, oils, hyaluronic acid. All these together acts as a natural moisturizer of the skin. So in winters, what happens is that there is low humidity, resulting in disruption of the natural moisturizing layer of the skin, because of which there's dryness and the skin tends to look dull and flaky. Also, what happens is that when it is windy, there's lot of moisturizer which gets evaporated from the skin. Therefore, there could be chapping of the lips, hairs can be dry and frizzy. There could be exacerbation of the already existing conditions. The people who are suffering from dermatitis, eczema, dandruff, there might be increase in that condition or it might come back during winters. So what I'm going to do today is to give you some few basic tips about how to take care of your skin and hair during winters. So first important thing is to avoid hot and long showers, which we everyone loves. I'm sure everyone loves to have a hot shower bath for a longer time in winters. Who doesn't loves it? So that you should avoid, because what happens is that because of heat, this upper protective layer gets disrupted and the water gets evaporated very easily, resulting in your skin to get very dry. So keep your bath short. Use lukewarm water as compared to hot water in order to protect your skin. Another important thing is to avoid soaps. So what happens is that when you use soap for bath, the soap results in the change of the pH of your skin from acidic to alkaline. That can again harm your skin, making it more drier and flaky. That's why it's always better to use shower gels. So what kind of shower gel you can use? You can use any kind of shower gel which is transparent, as they are milder and will not rip off the protective layer of your skin. Do not use any loofahs, do not use any scrubs, because any kind of scrubbing will rip off the protective barrier of your skin. After your shower, do not completely dry your skin. Make it, just dab your towel on your skin and let it be little moist. After that, apply a moisturizer on your skin so that the water on your skin gets trapped inside your skin, making it look good and supple and healthy. Now, if you have an oily skin, use a very light moisturizer that is more water based. But if you have a dry skin, then you have to use the moisturizer with lots of fatty acids in them. So look for the contents like cocoa butter, shea butter, olive oil, hyaluronic acid, and ceramides. This will kind of lock your moisturizer which are there in your skin and keep your skin hydrated. So that is the thing which you should do. Moisturize, moisturize, and moisturize. Even if you are washing your hands using a sanitizer in these COVID times, always once the sanitizer dries up, always hydrate your hand. Use a good moisturizer to hydrate your hand. So always, I know everyone do these things. In winters, we change from sandals to boots, cotton clothes to some warm clothes or the woolen clothes. Then why not our skin regime? We should not be getting into a routine regime of cleansing, toning, or moisturizing in winter. Avoid toner in winter because it's very, very important. Even if it is not alcohol based, you have to avoid using toner, because what toner does is that it rips away the moisturizer from your skin. Either it is alcohol based or not alcohol based, it will rip away the moisturizer and make your skin drier. So you can use cleanser and moisturizer and you are good for the day. After moisturizer, never ever forget to put a sunscreen, because sunscreen is just as important in winters as it is in summers. Even though the days are shorter, you still need a daily application of sunscreen to protect you from the UV rays. Don't be fooled by the temperature, as the UV rays can penetrate the clouds, it can penetrate the window of your car, it can penetrate the windows of your office. So sunscreen is a must even in winters, even if you are at home. So what should you look in the sunscreen before purchasing it? So make sure that your sunscreen is at least SPF 30 or more than it. PA 3 plus rating is must. So both of the things will be written on the upper cover of the sunscreen. So always check this thing. Always apply the sunscreen at least 15 to 30 minutes before going out in the sun. If you work directly under the sunlight, then reapply it every 2 to 3 hours. Also, do not forget to apply the sunscreen on the neck, as well as on the ears, as well as on the other exposed parts of the body. For those people who has sensitive skin or acne prone skin, try to use the physical sunscreen. So what I mean by the physical sunscreen, try to look on the contents like zinc oxide and titanium dioxide. These are the physical blocking agents, so that will not produce oil on your face, and that is very good for the sensitive skin. Also, these physical sunscreens can be used safely in children as well. So after 3 years of age, these physical sunscreen can be applied to the children's as well. So whenever you are stepping out, either it is winter, summer, irrespective of the climate, you should apply the sunscreen. Again, gel-based sunscreen is better for the oily skin. So look for these contents, look for SPF, look for PA value, and then only purchase the sunscreen. Do not get fooled by the advertisements. Another important thing in winters is that our lips tends to become very, very dry. And you tend to lick your lips, purse your lips like this. So it's important to avoid all this. Remember, the saliva is causing more evaporation of the moisture on your lips, making it dry, resulting in fissures and cracks on your lips. So to avoid the cracks and the fissures, always use a lip balm. If you're at home, you can use ghee, you can use butter, but remember to keep your lips hydrated. Always keep your lips hydrated. When you are purchasing a lip balm, there are few things which you should keep in mind. First, it should be free of mint or menthol. Number second, also avoid any fruit flavors which are there on the lip balm, because they cause evaporation of the moisture from your lips. So always avoid, look for these contents on the lip balm. If it is there, please avoid using that lip balm. Use a simple ghee Vaseline at home. Lip balm, therefore, what I say to my patients that in winters, keep a small lip balm in your pocket or in your purse, and should be a constant companion in the winter. Also, in winters, many of us face the problem of cracks in the feet or dryness of the skin of the hands or peeling of the skin of the hands. So, what you can do if you have cracks in the feet, then you can do a little pedicure at home itself. So, how to do it? Take a lukewarm water, soak your feet in the lukewarm water for about 2 to 3 minutes. Add a little oil if you want. That's not necessary at all, but if you want, you can add it. Take a After 2 to 3 minutes, take a loofah or a scraper and scrap off all the dead layer which are there on the feet. Do not scrap the whole body because that is not recommended. That will result in the thickening of the skin. Just the feet, the extra layer, the dead layer should be scraped off. Once you scrap it off, do not dry it again. Completely dry your feet. Make it, leave it a little moist. Then apply a moisturizing lotion. Massage it for 2 to 3 minutes. If possible, wear a socks after it at least for 1 or 2 hours, so that all the moisturizer, all the this water gets trapped inside your feet. Okay, to avoid the dryness of the feet and to recover from fissures or cracks. Also, in winters we don't feel thirsty and tends to drink very less amount of water. So what you should remember is that you should drink at least 6 to 7 glass of water every day. Keep a glass of water on your table or wherever you are working, even you are watching TV, just take a glass of water and drink. Make sure that you drink at least 6 to 7 glass of water every day, because if you won't drink the water, then it will dehydrate your skin and make your skin further dry and dull. Now, about diet, it's very good to have flax seeds. If you have flax seeds at home, then make sure that sorry, make sure that you eat flax seeds as they are warm and gives you omega-3 fatty acids. Also eat lots of dry fruits like almonds, walnuts, and cashews. They help to keep the skin healthy and glowing. So always remember that in winters, eat healthy diet, eat lots of fruits, lots of vegetables, lots of cashews, lots of flax seeds. Avoid any oily food that will again result in dullness, dehydrate your skin. Avoid fast foods. It's very important to have a proper diet in winter along with lots of water. Whatever you can drink. Coconut water is also good. 6 to 7 glasses of water includes both the coconut water as well as normal water. So drink a lot of water. I know caffeinated drinks we enjoy a lot in the winters, all these hot cup of coffees, teas, hot chocolates, but again all these caffeinated drinks will, you know, rub away the moisturizer from your skin and make it look dull. So avoid consuming excess amount of coffees or tea in winters. Coming on to the hair, in winters, usually we face the problem of dry and frizzy hair. So avoid shampooing your hair with the hot water. That is the number one thumb rule. Do not use hot water to shampoo your hair. Use lukewarm water to shampoo your hair. What happens is that when you use hot water, heat breaks up the disulfide bond which is there on the hairs, making it look more frizzy, brittle, and dry. So do not forget to use the lukewarm water, even if you love to have the bath with the hot water. One more thing, even after you take the shampoo your hair, use a conditioner. Even if you have a thin hair, if you have whatever the kind of hair you have, always use a conditioner with it. So you apply the conditioner on your hair. Do not apply it on the scalp skin, otherwise it might cause dandruff in your hair. So always use the apply on the conditioner hair. So conditioner, you should keep it at least 4 to 5 minutes on your hair and then rinse it with the normal water. That is what you should be doing for the hairs. Winters is also a time for partying, lots of celebrations like Christmas, New Year. So, what we tend to do is that we tend to use the blow dryer, straightener. Almost every day we go for hair rebonding, hair straightening. So, please, all these things works on the basis of heat, that you should remember in your mind. And what heat does is that breaks the disulfide bond on your hair, resulting in dryness and frizziness. So try and restrict to use them. If needed, blow dry your hair on the cold setting. I know that will take longer, no doubt in that, but it will at least retain the moisture in your hair and will not make the condition worse. So if you want to go for rebonding, straightening, keratin therapy, remember one thing: give gap of at least 6 months to 1 year between each therapy. Do not overdo them. Number second thing is that keratin therapy, many of the patients comes to me that, ma'am, okay, keratin therapy is a nutritional therapy. No, it's not a nutritional therapy. It works on the basis of the heat and makes your hair straight, though it's less harmful as compared to the straightening, but it's going to harm your hair, and it's not a nutritional therapy. It doesn't provide nutrition to your hair. That you should keep out from your mind, that it's a nutrition therapy. So keeping all these things in mind, the the take home message is that you should moisturize your skin daily and as much as required. Whenever you're washing hands, using sanitizers, keep a moisturizing lotion in your bag or on the basin and moisturize it. Do not forget to moisturize your neck, your hands, your feet. That is the most important part of the body, and that is the part where you get the most of the diseases. Second thing is that your hairs, do not overdo your hairs. Do not use the straighteners. Do not use the blow dryers every day. Maybe once in a while it's okay to use all these things. That will not harm your hair. Number third thing, hair rebonding, straightening, keratin therapy should be done in a gap of 6 months to 1 year. And these are all not a nutritional therapy. They are not going to stop the hair fall, increase the, I mean, they are not going to stop the hair fall. They might increase the hair fall. Again, other than this, what you should be doing is that if you have dandruff, stop applying any kind of hair oil. In winters, what we like is the lukewarm oil massage in our hair. Please do not do that. Do not apply any kind of oil in your hair, especially if you have dandruff, because it will tend to increase the dandruff. The oil tends to increase the dandruff. So do not apply any kind of hair oil to your hair. If you want to apply it, just apply it half an hour before taking bath. We have the tendency to of putting the hair oil and sleeping at night. Do not do that, because all the dust particles sticks to our hair and makes the condition worse. So all these things you should keep in mind. If you have any questions, please drop a message in the chat box. I'll be more than happy to answer them. And I guess all these skincare and the hair care tips will make you and enjoy your winter with a glowing skin. So if you have any questions, please drop your questions in the chat box. I'll be more than happy to answer them. So there are few questions which I'm getting from the audiences. So this one question is that what is fungal infection and what it causes? When will Okay, so fungal infection occurs due to, it's an infection which occurs due to the fungus. That's why it's called fungal infection. And what causes it? It It occurs due to humidity, due to wetness, due to sweating in that area, or sitting for long hours. It can be communicable, it can be transferred from one person to another. So make sure you keep your clothes separate, don't share your towels, and take a proper treatment for it. And if you are pregnant, or if you have delivered the baby, can spread to them also. It's important to take the medicines, proper medicines, which are available in the market, which can be used safely during the pregnancy and after the birth also. After the birth of the child also, it can be used safely without any harmful effects to the child. So another question which has is that, ma'am, I'm having lips dryness during 1 year. I'm using Tecrose 4 cream during 3 months, but no use. So please stop using Tecrose 4 cream. It's not for dryness of the lips. As I said, if you have listened to this webinar, use ghee, use butter if you're at home, or use any lip balm. Just check the ingredients and avoid mint, avoid fruit flavors. Other than that, you can use any lip balm. What I think is that white petroleum jelly, which is available, it's a very good moisturizer for the lips. So first of all, stop applying the tech rose food and try what I'm telling it to you. Other than that, there is this, I have nodule on my cheek, what should I do? So the thing is that you should go to a nearby skin specialist, get it examined. So there are many causes of the nodules. First, we need to find out what kind of nodule it is, what and why it has occurred, and then only you can take a treatment for it. So for proper treatment, you need a proper diagnosis, and for the nodule, you need to have a physical consultation. So, hi doctor, can you suggest some good moisturizer for dry skin? Yeah, of course, I would. There are many, I don't want to say a name of this specific moisturizer, but what you can look for in the moisturizer when you are going out is the cocoa butter, shea butter, olive oil, ceramides, hyaluronic acid, all these contents. If there is in the, if even the 80% of the contents are there in the moisturizer, it's a good moisturizer. So always check the contents before purchasing a moisturizer. Okay, so coming on to the next question. How do I remove my dandruff? So you need to see since how long you are having the dandruff. Number second thing is that do not apply any kind of hair oil. Number third thing is that you should shampoo your hair regularly. Prefer doing the shampoo at least alternate day. If you can't wash your hairs daily, at least shampoo your hairs alternate day. Third thing is that use ketoconazole based shampoo. And if it doesn't goes away with all the things, then visit a nearby skin specialist and get a proper treatment done. Okay, so moving on to the next question. I have an oily scalp with dandruff, but straight is silky with split ends. What would you recommend? So I guess I have already answered it for the dandruff. For ends, you should start eating, if you're a vegetarian, eat lots of pulses, lots of sprouts, have some fruits like banana and apple is very good. Coconut water is also good. Other than that, if you're non-vegetarian, then have boiled chicken and fish. That is very good for the hairs. Take some biotin supplements for your ends at least for a month. But even if you don't get the response after a month, then contact a nearby skin specialist. Remember to contact a skin specialist only for this thing. So other questions are, I have white moles. So, ma'am, I'm having a hair fall and my hair is becoming thin in length. What should I do? So, darling, what you need to do is that you need to have proper diet. Start with proteins, minerals. You have to have the fruits like banana and apple. Other than that, start with some supplements like biotin supplements, vitamin D, vitamin B12 supplements. Stop applying any kind of hair oil to your hair. Other than that, take these medicines, but the most important thing is to consult a skin specialist and get yourself examined for the proper response and the 100% response. See, if you start the treatment earlier, the response is better and the responses will be faster. Once you delay the treatment, the duration of the treatment increases. So never delay the treatment. It's just a one-time visit. You go to a doctor, he or she will suggest you something, start with that. So we have many questions. So this, I have heavy dandruff. I'm using Cilicia KT shampoo for it. Is there anything else for that? Yes, there are many good therapies which are available. There are many good lotions which are available. But for that, you need to visit a nearby skin specialist. If the dandruff is under control with the use of the shampoo, then there is no need of visiting the skin specialist. And the frequency of the shampoo should be alternate day, at least alternate day. So another thing is that, can you guide me how to cure dark circles? So again, it's a very dark circles is a very, very common problem. Many of us face that problem because of the long studying hours, long working hours, being on the laptop for a longer time. So what you can do is that there are few basic things which you can do at home. Number first, at least take 6 to 7 hours of sleep. Drink lot of water. Avoid salt. I mean, lower the salt in your food. Whatever the salt you are having at present, just reduce it to 50%. Whenever you get the time, take a what you call it, shira kakdi. Keep it on your eyes and relax for 5 to 10 minutes. That will again improve, help in the dark circles. There are many creams which are available for dark circles. These are hydroquinone containing cream and some steroid based creams, but I don't recommend you to buy it by yourself. Just go to a skin specialist. Whatever they give you, the many good creams are available, I would say, these days. So start using those creams. I know you'll definitely 100% you'll get the results. Other than that, so hello ma'am, whenever I go to in sunlight, my skin gets swelled and red and lots of itching is there. I've been to so many doctors and they have, they problem will always be there. So yeah, so what you have is a sun allergy. Okay, so you need to understand that it's just an allergy, it's not a disease. Okay, so you need, whenever you're going out in sun, stay protected, use the protective clothings, wear the full sleeves shirts, wear the hat, apply the sunscreen. See, the sensitivity of the skin reduces with age, and try to have the medicines, I mean whatever your doctors has prescribed you, because it will help in healing of the skin and reducing the sensitivity of the skin. So that is very, very important. Do not leave the medicines in between. Coming on to the next question, ma'am, I'm having I guess, how can I prevent it? Having combination skin, I can neither use oily products nor the dry one. What should I do? When I use oily products, I get a pimple, and dry one makes my skin too dry. So what you can do is that when you have these kind of combination skin where you can't use the oily products also, you can't use the dry products also, then you have to combine all these products together. So use these products, use the products like vitamin C serum, serum containing hyaluronic acid, alternate with the creams like tretinoin, salicylic acid, lactic acid. So this will balance your skin. So it will not make it too dry or not make it too oily. So always look for the products which has the combination of these things like vitamin C, ferulic acid, lactic acid, tretin. Or use the serum one day, one night, and one night you can use the products containing tretinoin, salicylic acid, lactic acid. That way it will balance you. Madam, can you suggest natural and the medication for pimples and for oily skin? So yeah, so natural, first of all, do not use any homemade remedies for the pimples or oily skin. That again will harm your skin. Like it's very common practice to use toothpaste. Never use toothpaste. Never used any pepper on your pimple. It's going to burn your skin away. Number second thing is that use the products containing tretinoin, salicylic acid, lactic acid. Face wash, you should be using the salicylic acid based face wash. So always look for all these things. But if your acne doesn't goes with all these things, then it's the time to visit the doctor. So moving on to the next question, ma'am, my skin is getting wrinkled. What should I do? So that's a very good question because many of us is facing the problem these days because of the over washing of the hands or the use of the sanitizer because of these COVID situation. Because of the overuse of these things, the upper protective layer of the skin is getting destroyed, and because of which we are getting the wrinkles on the skin. So what you can do is that always whenever you are washing the hands or using the sanitizer, always do the moisturizing thing after that, so that it can heal your skin, it can protect your skin, and will prevent the formation of wrinkles as well. Ma'am, I'm having blackheads on my nose. I even applied charcoal face mask. After this, the texture is smooth, but the blackheads will not has not gone away. So, darling, you need to understand that the blackheads is not going to go away with the face wash. Okay, you need to have a proper treatment for it, and you need to have few procedures to get them removed. So once you get them removed, then you want to start something so that it doesn't comes back again. So first of all, you need to visit a skin specialist, get it removed, and then start the cream which is containing retinol, tretinoin, or salicylic acid to prevent it from happening again. So moving on to the next question, I'm having keratosis pilaris, which worsens especially during the winter season. What should I do? So, first of all, never forget to apply the moisturizer. You should moisturize your skin at least 3 to 4 times a day to prevent the dryness. Number second thing, you should use the creams which contains tretinoin, salicylic acid, maybe some combination of steroids with them, but do not use the steroid based creams for a longer period of time, otherwise it will damage your skin. So it's always better to visit a doctor, and there are few tablets also which are available which can give very good results for this, which are vitamin A containing tablets. I'm so sorry. I'm having cough. So I have hair loss problem from last year. Doctor prescribed this disease as lichen planus pigmentosus. I need your kind suggestion. So hair loss problem in the planus pigmentosus is very common. What you can do is that there are many good tablets and the creams which are available for this, but it's not possible to advise it on the chat before looking into your condition. So it's better to visit a doctor and start with the proper therapy. Once you start with the proper therapy, it's possible to cure it and to regain your hair back. So do not delay the treatment, because delaying the treatment will worsen the condition. Hi doctor, how to get a skin glow? So skin glow is always a inside out phenomena. What I think is that it's both the combination of inside thing as well as outside thing. So what you need to do is that drink a lot of water, at least 6 to 7 glass of water every day. Have a healthy diet with lots of fruits and vegetables. Avoid cold drinks, ice creams, and chocolates. That is what you can do at home. uh, at night, you can use vitamin C or hyaluronic acid containing serum as well for the good results. So moving on to the another question, ma'am, I'm getting pimples due to wearing face mask. I'm using MS Deriva for 20 days for no use. So again, it's a very common problem which people are facing, that getting pimples because of wearing face mask. So first of all, make sure that your mask is made up of some cotton material. It should not be too tight on your face. Number second thing is that before wearing the face mask, use some salicylic acid face wash that will help in repairing your skin and treating of the curing of the pimples as well. After once you remove your mask, make sure whenever you are wearing the mask or removing the mask, you should face wash. You should wash your face with a good face wash containing salicylic acid. Number third thing is that if you have lot of pimples which is not going away with the Deriva CMS, this Deriva gel, then you should think about it and visit a doctor, because it's the time to start with some tablets to support your skin and heal your skin. So moving on to the next question, how to treat onychomycosis of bilateral picto. Uh, so onychomycosis in a simple term is a fungal infection of the nail. So there's no homemade remedies which you can do at home. There's only treatment which you have to take it either for 3 to 6 months to get a proper cure. Do not leave the treatment in between. Otherwise, you might have to take the treatment for 4 or 5 years together. So always make sure that whatever your doctor suggests, you do that properly and do not stop the medicines in between. And keep that food area clean and dry. So today's next question is that how to treat the pores on the face. So it's a very good question. So everyone has pores on face. Some people has big pores. So what they actually do, these pores, the oil which is there on the skin, it comes out through these pores. It's very important for us to stay young. But if you have large pores on your face, then what you can do is that you can use the serums or creams containing tretinoin, salicylic acid, vitamin C, hyaluronic acid, lactic acid. All these things will help in reduction of the pores. But if you want the best results, then you might go to a nearby skin specialist. Combine all these serums with some therapies like laser therapy, radio frequency. So it will help in giving you the best results. Another question is that using Acnerics face wash for pimples, is it good? So yes, it's a good face wash. It contains salicylic acid, so you can continue using it. Another question is that how can I take care of my pimple on face? I guess I've already answered this question, that if you have pimple, then you can use salicylic acid face wash along with the creams containing tretinoin, salicylic acid, clindamycin, benzoyl peroxide. All these creams you can use. But what I would suggest you is that do not use any of these creams without the recommendation by the doctor. So I guess we have covered most of the questions. So this is the last question which has come up, that I get white pimples before my periods. What should I do? So darling, it's a very, very common problem which we face. So what you need to do is that it's mainly because of the hormonal change during your periods. What you need to do, if it's a continuous affair, then you might have to start some tablets and creams in order to repair your skin, so that even if you have periods, the pimples won't appear on your skin. So I guess I've answered most of the questions. So let's end it. And I guess you'll have a glowing skin in winter. Okay, bye bye.
Download the MediBuddy app now. Subscribe to our YouTube channel for more updates.